we are our kickoff speaker, which is Dr. Julie Levy, which is phenomenal, and a huge thank you for her taking the time to join us today. Dr. Levy is going to be talking with us today about new feline leukemia testing breakthroughs for diagnostic confirmation and predicting long-term survival. And everybody should have a copy of the schedule. Dr. Levy's work at the University of Florida focuses on the health and welfare of animals in shelters, feline infectious diseases, and humane alternatives for cat population control. She founded Operation Catnip, a nonprofit university-based community cat trap-neuter-return program that has spayed, neutered, and vaccinated more than 65,000 cats in Gainesville, Florida since 1998. In 2008, she joined Dr. Cynda Crawford to found Maddie's shelter medicine program at the College of Veterinary Medicine, an educational and discovery initiative with a global impact on the care of homeless animals. In 2014, she joined Dr. Kate Hurley to launch the Million Cat Challenge, a shelter-based campaign that has saved more than 3 million cats in shelters across North America. Dr. Julie Levy is the Fran Marino Professor of Shelter Medicine Education and the Maddie's Shelter Medicine Program. So Dr. Levy, I'd like to welcome you to the Online Feline Leukemia Day of 2021.
That's it, we got it. Well, I am very grateful to be invited back this year to this conference. I love that this is a laser focused conference on FeLV, which continues to be a great threat for cats. But fortunately, we are seeing improvements in attitudes about saving these cats, as well as some diagnostic and therapeutic advances. So let's start. I'm going to talk today about testing for the most part and share some very new information that we've just published about breakthroughs for diagnostic confirmation. And these tests that not only tell you if a cat is infected or not, but give some clues about the survival of the cats and whether they are sort of set up to be long-term survivors or to have early disease. And this is the first time we've ever been able to do this outside of a research laboratory. This is available to everybody. So I did provide a copy of the American Association of Feline Practitioners Feline Retrovirus Testing Management Guidelines to the download. So I do recommend that everybody click on that box and download this document. It's pretty long. It is got all the details about what we're going to be talking about today. So if you want to go back and see the backup documentation or take a deeper dive, then you will find everything here. It's just updated in 2020, so it's fresh review. But today I'm going to pull out just some highlights that I think is important for everybody to know the most important parts of this document that you can carry around in your head and you can advise your organizations and your veterinarians and others working in this field. So with that, Stacy, could we do the poll?
Oh, great. I was just wondering if you had remembered that. Fantastic. I'm ready to go. Excellent. All right. All right. So do you work with an animal welfare organization? Are you a shelter veterinarian, shelter staff, or shelter volunteer? Are you part of a private rescue or foster, or a veterinarian staff or volunteer? Are you part of a veterinary clinic, either the veterinarian, staff, or volunteer? I rescue on my own. I'm not affiliated. And then if there's an other, please put that in the chat or in the questions box. Sorry. So we've got about 23% are shelter veterinarian staff volunteers. 51% are part of rescue groups or foster, either veterinarian staff or volunteer. We have just 2% from a veterinary clinic. 11% I rescue on my own, I'm not affiliated. And then the other, there's about 12% other, put in the chat. We have here TNR, not nonprofit. What if I fit into multiple categories? Rescue founder, cat sanctuary. I run a rescue, but not a vet. Okay, excellent. All right, so then I am going back. We'll go back to your screen here.
So quite a variety of people here that are interested in helping cats with FeLV, and I'm certain that we will have something for everyone. And Stacy, if you'll remind me as we're going through where I put my polls, because I don't see them on my view.
Okay, slide 7 is next.
Okay, so this is a brief overview of what we're going to be talking about today. We will have updates in each of these categories. So the thing I get the most questions on is routine testing protocols. There are so many options of different tests and different labs and serial tests that you can do. And people have a real time struggling with how to pick a test, what order to do, what does it mean when they don't match. Should they keep testing? And then what should they do with a cat with a positive test, especially if there's multiple cats involved? So we're going to try to answer those questions. Then my most exciting part today is just brand new published information about staging, how we can use our PCR test to actually see if they have a lot of virus or a little bit of virus and what that means for the cats. Just remind everybody what we know about FIV. I'm going to briefly refer to FIV today because I can't help it. We love these FIV positive cats, and also most of the time when you're testing for FeLV, you get that FIV result as well. So we want you to know what to do with those. We'll talk a little bit about some changes that are happening in shelters and in rescue groups as far as screening and who should be screened. And then finally, just come back to the full circle that these cats deserve a home. They are just like any other cats, and even if we don't know what their long-term outcome will be, we know that in the short term, they're usually very happy and they should be in homes. And it's better for them, they'll live longer on average if they are in a home with few other cats than if they are in an institutional setting like a shelter or sanctuary. So first, just to bring us all up level on the same page, this is not new information. This is what we've always known about FeLV and FIV, but it's always good to have a little refresher. You are my students today, and so we got to give you the background. So FeLV, remember, is spread by close contact and body fluids. This is considered to be an infection you give to your friends. So mother cats spread it to their kittens is the most common way, but it can be spread within households still. So we do need to be careful about not mixing up positive and negative cats in households, and it can be spread by fighting through bite wounds. The most common outcomes are progressive infection. This is when the cat really fails to control the infection, the virus level goes up, and it spreads to all parts of the body. And these are the cats that as a whole are at increased risk of developing an illness that are contagious to other cats, mostly through their saliva, and most of the time are pretty easy to diagnose. You can run a routine test on them and they will almost always be positive. Regressive infections, on the other hand, that means the cat didn't have enough immunity to fight off the virus completely. They are infected, but they keep it suppressed at a very low level. And so they can actually feel and behave like they are not infected. The virus is quiescent. They can live a normal lifespan. At the time they are regressive, it is not contagious to other cats. They're not shedding. And a challenge is many of these cats have such little virus, we can't even detect it on a blood test. And so if we run our routine blood tests, we're going to get a negative and we're going to assume they're regressive. And FIV, in contrast, is spread mostly by fighting. So bite wounds are the most common way that FIV is spread from cat to cat, which is why we see it spread primarily among adult males because they're the ones that fight the most. This is different than FeLV, that it's very unlikely that friendly cats within a household will spread it to each other because they're not breaking the skin with bites. So we've really loosened up a lot, and we really don't discourage people from adding a FIV positive cat to their household. It's not 100% safe, but it's like 95% safe. Very unlikely to spread it. And the outcome for FIV is also more predictable. They do have lifelong infection. They never get over it, but they have a very, very long asymptomatic phase. They may die of old age or another disease and never have any signs associated with the viral infection. So we really need to think very positively about these cats with FIV because they're likely to do really, really well. So I circled this section of the FeLV slide because this is what I want you to tuck into the back of your head. It's going to influence everything that we talk about from here on out. So remember that there are two common outcomes of FeLV, the progressive kind, which is sort of the classic disease that can take their lives early, and that spreads from cat to cat. And the regressive disease, in which the cat is suppressing the virus because it has a good immune system, it's not spreading, and they may test negative. And that testing negative sometimes is what can really mix us up. So here's another way to look at FIV. This is a chart of the life cycle, and it starts at the top where some cats are fighting, and the positive cat bites the negative cat and spreads that infection. There's usually within a few weeks, cats may have a little mild disease, mild fever, not feel so good, but most cat owners are not even going to notice this, and veterinarians are not going to be presented with cats in this acute phase. And then the cats enter a very, very long asymptomatic phase. They shed virus in their saliva, and they have antibodies in their blood, and that's what we test for in most of the tests that you would do at the vet clinic. The point of care tests, like a SNAP test, that is going to be an FIV antibody test. And then some cats may break off and actually develop clinical disease. Stomatitis or inflammation of the mouth is the most common. They can also have infections that don't clear up as quickly because they may be immune suppressed, and that would be like upper respiratory infections that don't clear up, or ringworm, or other problems that are long-term. And what that means is when cats have FIV, if they get an infection, we just need to make sure that we're treating those infections early and aggressively, because they may have more trouble recovering. Okay, here's FeLV. This is a new vision of FeLV. It's different than the typical cycles that we have shown before. And this is the hard part that's to understand. This confuses my veterinary students. This confuses veterinarians. It can confuse all of us at times. And so this is another thing to sort of tuck away during our time together today, because we're going to refer back to it a lot. So in this case, the cat on the left, the gray cat, is infected with FIV or FeLV, potentially from its mother. That's the most common way. And then if it has a weak immune response, that virus will proliferate, expand, spread everywhere in the body, and we will be able to detect it by testing a blood sample. There will be a lot of viral proteins, these are called antigens, and a lot of viral provirus, which is DNA and RNA from, well, DNA from the virus. And so we're very, very likely to detect this cat because there is so much virus available. And these are the ones, because the virus is everywhere, that it can cause a problem. They can develop illness, such as lymphoma or other immune suppressive diseases, anemia, and they can die young, usually within a few years. On the other hand, there's a very good chance this cat could develop a strong immune response and not eliminate the virus totally, but suppress it and keep it suppressed for years. And as long as that virus is suppressed, there's low viral DNA, low viral antigen, sometimes below the level of detection even, these cats don't have clinical effects, and these cats may live a normal lifespan. In the past, it wasn't possible to tell the difference between these two kinds of cats, but in the recent past, we've validated a test that's quantitative that can help us sort cats into these buckets and understand them better. So with that background in Virology 101, let's move to some routine scenarios that face us every day as we work with cats. The first one I really want to emphasize, it starts with doing the test right. Everything else will fail if you don't do the test right. So the one thing you do is you select a good test. Not all of the brands are the same. There are some brands that we recommend that are highly reliable, and there are some brands that are highly unreliable. And once we use an unreliable test, then nothing else can we be very confident about. And I'll talk about those brands on the next slide. Another thing is whole blood actually is the most sensitive. This is going to surprise some people that are hearing this, is that we used to say and believe that we had more false positives with whole blood and that serum was a better test, but that actually was a misunderstanding due to this phenomenon of regressive infection. And I'm not going to get into all of the details of that right now, but because whole blood is more sensitive. When we remove the cells, the red cells from a sample to make serum, we're actually removing some of the virus. And so we can miss those regressive infections if we're just testing on serum. This is really good news because whole blood is a much more convenient sample. We can get just a few drops of blood from a cat. We don't have to process it and spin it down to be serum, and we can use it directly in the test. We also want to use the test the way it was intended. So that means you really do need to read all those instructions in that little packet with fine print that comes with a box of tests. They're all different. So you can't assume that you would run one brand the same as you would run another brand, or that within a brand that the heartworm test will run the same as an FeLV FIV test. So make sure that you review those packets regularly to remind yourself. And also, if you have volunteers or staff that are running it, you can't just assume everybody knows how to run these tests. They are very simple, but there is a nuance, and you can make a mistake by not just following the directions, reading it at the time they say, putting the proper number of drops in the test. All of those things are opportunities for errors. And another mistake I hear about when people call is that they're trying to extrapolate the results from one cat to another. And there often is this misconception that all the cats in a group are likely to be the same. And some examples would be that all of the kittens would have the same status in a litter, and that is not correct. You can have some positive kittens and some negative kittens. So it's just a roll of the dice if you're not testing all of them, which one you pick, and you can't assume that that one that you pick to test will reflect the others. You also can't assume that the kittens and the mother are the same. She may have a regressive infection that you miss and may have passed the infection on in a progressive form to the kittens. So if it's important to test a cat, to know the status of a cat, you really do have to do one test on one cat and run it the way it was intended to run. Like, really don't try to outthink these tests. They are developed in the lab and tested and refined to be used in certain ways. The one thing I'm not going to get into, because I think we all know it now, but I just want to make sure I mentioned it, is who to test. So we're going to talk more about who to test in shelters, but I want to briefly mention that in TNR programs, it's the one exception to the suggestion that we know the status of all cats. In TNR, the way we help cats the most is by spaying and neutering as many as we can. And everything we do that takes away from that takes away from the welfare benefits that we're trying to achieve for TNR cats. We know, especially this year and after a year of COVID that has suppressed our ability to get spay-neuter done, shelters are full now, rescues are overwhelmed with kittens, and then those crowded facilities start getting disease like pan-leuk and URI, and it's a very vicious cycle. And we know that the vast majority of those kittens and stray cats come from the free-roaming community cat population. We will have the biggest impact possible if we double down and triple down on doing more TNR to prevent those litters from being born in the first place. And that means our TNR programs need to be highly efficient and streamlined and really focused on the essentials. And the essentials for TNR are spay and neuter and vaccinations. And if we can take some of the money that's diverted to other activities and spay and neuter a few more cats, we're going to be way ahead in the long run. The other thing about testing cats for TNR is usually within a community, we're only getting some of the cats. Most of the cats are still out there. So if we identify and remove a few of the positive cats, it really doesn't change the dynamic in the neighborhood level at all. Also, spaying and neutering reduces the primary ways these viruses are spread. So FIV is spread primarily by tomcats biting each other. And once these stray cats are neutered, they really just stop biting and start laying around and waiting for their next meal to be delivered. And also, FeLV is spread primarily from mother cats to their kittens. So when we spay a mother cat, even if she's positive and stays in the neighborhood, she's not producing positive kittens anymore. So that is a bigger impact on reducing both FeLV and FIV by neutering more cats than if we brought in fewer and tested and removed the positives. So that is in the spay-neuter guideline, or the FeLV FIV guidelines from AAFP, if you want to read more about that. But I think the short story, if you just want to remember a highlight, is we no longer recommend testing cats in TNR programs as a routine. Of course, you might want to test a sick cat or something as an exception. So we've done a lot of research with different brands of tests, and this is for the purpose of identifying which is the best one. Sometimes life and death is in the balance on the basis of what colors and lines turn positive in these tests. So we want to start with the most reliable test positive, not one that has a high error rate. So we took hundreds and hundreds of samples that were well defined. We knew exactly what the FeLV and FIV status was of these using laboratory techniques. And we split the samples and ran them in all of these other tests side by side at the same time, so we could compare with confidence their accuracy. And what we found was that the IDEXX SNAP test was the most accurate of the group. The Zoetis witness test was a very close second. So I would say that these are the two tests in the United States that you should reach for. The IDEXX SNAP test is the best. Zoetis witness is a very close second, certainly acceptable. And there are some advantages. Sometimes the SNAP test is more expensive. It also has to be refrigerated, and it's a little bulkier. So sometimes it's more practical for folks to have a drawer with the witness tests in them. However, I would say if cost is the difference that you're making the selection on, you really should go back to your distributor and ask them to match prices, which they very often do. So no harm in asking, right? Here in feline medicine and in rescue, we're pretty shameless in trying to negotiate for discounts. I encourage you to do that. The BioNote antigen is very good. It works as well as the Zoetis witness. It's not available in the US, but I know we have some international listeners today. So if you have the BioNote antigen in your country, I certainly recommend this one. The one I would not recommend is the AvAccess Vet Scan. It's a very popular test because it's easy to read and it's very cheap and easy to use. But we found with FeLV and FIV and with some others like heartworm and parvo that we were getting a lot of spurious results. And we're always screening because we need to know the actual result. So we don't recommend this test. Now, to make it more confusing, this has now been purchased by Zoetis. And so now this is a Zoetis Vet Scan. So there are two Zoetis tests. One is very good and one we don't recommend. It is very important that your purchasing agent buy the test that your veterinary professional recommends. And especially in big organizations, or if you're a small rescuer and you're going to a veterinarian, you may not be the one who makes the purchasing decisions. And especially in the municipal agencies, the purchasing department is just going to buy the cheapest thing. That's their mandate. So it is very important that the veterinary professionals and the experts monitor the purchasing to make sure that you're getting the tests that you want to get. This can easily go awry, and we see that all the time where the vet doesn't even know that the brand has been changed. All right, this is probably the most important set of slides that I'm going to talk about. This is the way we recommend testing now. Now, you know, if you've looked at all the options in a lab checkoff list or read another book, that there are so many different kinds of tests that you can use. There's antigen tests, antibody tests, Western blots, PCR, IFA, and it can become a blur of initials when you're looking at them. And of course, they all claim to be the best. And every article that you read may compare some of them, but not all of them. And it really is hard to line them all up and make good choices. It was hard for us too. And so we actually did a study in collaboration with Austin Pets Alive, where we followed naturally infected cats, 130 of them, and we're still following them over a period of years. And we also tested them with a whole panel of all of these different tests every month. And our goal of that study was to determine once and for all, what is the best testing protocol? And I can say, I'll share a little bit of data later that we didn't exactly answer that question, because it turns out that a lot of cats, especially, well, for FeLV, is they don't follow the rules. Like, they didn't get the book to read. And so they test positive on this time point and this test, but not on another. So we sifted through hundreds of thousands of test results in this study to narrow it down to what we think is the most practical, and then to also identify that there's a level of uncertainty that we just have to learn to live with. And once that we do give up the idea that we can keep testing until we know for sure, it's very liberating and we can just go on and save cats. I think another thing that is different now is what happened when a cat had that positive test has changed. It used to be a death sentence, and so that was a source of a lot of anxiety about our testing. And now we just say, you know, segregate them and adopt them out. It'll be okay. And that is such a relief because we're going to help these cats regardless of their test results. So I call this the FeLV FIV testing option A. So you have one option, which is one and done. This means you test once with a good test and accept the result, knowing that you will be wrong a few times, but hardly ever. Most of your tests are going to be right. And as long as we're not euthanizing any cats because of it, it's okay. So we start with the point of care testing. That's what most people are going to do. This is so easy to do. And even if you don't have a veterinarian, you can order these tests and you can learn to take a couple drops of blood from a cat and run the test appropriately. So that really helps with cost and time management. So my test of choice would be the SNAP combo tests. But if I didn't have access to those, I would use the Zoetis witness test, and I would do that kind of patient side. I take a few drops of blood from the cat and run it, and then you will get a positive or negative result. And I would just live with that. And unless there were special circumstances, like it was a hoarding case, so there was a high risk of recent exposure, or a big cat bite abscess, I wanted to follow up on the cat later in case he recently got infected, or he's got, it's a litter mate that was positive, so he's negative and I'm not sure I trust it. Those are exceptions that you are not going to come across very frequently. You are going to usually be right with this test. So one and done is the right test, maybe for most circumstances. And in shelters or other places where mass testing is being done, it's probably the appropriate one to make the best use of our time and money. I did make a note here that whole blood is the most sensitive sample. That was really happy for us to discover in our study because that's also the easiest sample to use. All right, but sometimes you will have people that really want to go to the next level. They either have a test result they're not confident in, or they are just really curious, or there's a special circumstances like a recent exposure. And so this is what I would say would be your testing option B. Notice I'm not calling this a confirmation test. I think we've really confused people by having screening tests and confirmation tests. When we use that language, people assumed that the confirmation test was more accurate, and that is not the case. It is just a different test. And when the screening test and the confirmation test don't agree, we call that discordant, and you can't know which is right. So I'm calling this testing option A and B a two-stage test. So the first two lines are what you saw on the previous slide. We test and we accept the result. But if we want to go to the next level, we use PCR. Notice I said PCR and I didn't say Western blot, IFA, different brand of tests. There's a lot of things that we sort of, our big study was able to scrape away and say the only thing we need to do now as a second stage test is PCR. And we did this work with IDEXX. We've worked with IDEXX for many, many years. And I know this probably sounds like an IDEXX commercial, but it isn't. That's the one lab that works extensively with researchers to support their work and accepts the results, whether they are positive or negative for their brand of test. But they're the only ones currently also offering this quantitative PCR in a validated way. So this is the best test for now. And so if you do your PCR test after your screening test and it doesn't match the first screening result, that's discordant. And what we say is we don't know for sure the status of the cat. And so we need to either make our best guess or wait and retest later in the future. If it's the same result, we call that confirmed. So now we can go forward very, very confident. to the best of our ability, we know the status of the cat. Just remember, it's not going to be 100% perfect. We're never going to get to perfection, no matter how many tests that we run. And if the cat's test result is negative, and there's a recent exposure, you might want to come back in a couple months, really, to give them the most time possible to turn positive and do a PCR then. I also made a note on this slide that we do recommend PCR for some critical testing. And the best example would be that is screening blood donors. If our blood donors are carrying regressive infections that we can't detect, or they fail to make antibodies against FIV, for example, they can easily pass those infections to a sick cat that they're donating blood to. So all of our blood donors should be screened by PCR. It's part of the official screening for blood donors. All right, so I know your head is exploding already, and I have more. So what's more is, as a result of our lifelong study in FeLV positive cats, we now have a PCR test that is quantitative. That means that you no longer just get a result that is positive or negative from the lab, or at least the IDEX lab. It comes with a number that tells you the amount of virus that is circulating in that cat. It's a DNA copy number. And this has turned out to track very closely with the outcome of the cats. So this is really exciting to us, because now we have more clinical information. And also in the future, as treatments become available for cats, clients will be able to repeat this test and see if the treatment is working in the cat to suppress the viral level. This is what's done in HIV, and it's very, very important, because if a treatment is not suppressing viral level, you need to move on to a different choice. So cats that have a low proviral DNA copy level are likely regressive infections that are going to do very well, whereas cats with a high copy number are likely to have progressive infections. And as a group, those are the ones that are likely to encounter problems earlier, but there's always exceptions. So tuck this in your mind as well about this proviral quantitative PCR test that we can do now. So that's going to lead us right to this new FeLV staging plan. I love this slide because it shows why sometimes testing is confusing. If you work with community cats and you're getting kittens brought in from the public, and the mother cat and the kittens don't match, it's one of the questions I get most commonly. How can that be? One of the possibilities is that it was a regressive infection and we just couldn't detect it in the mom, but it's in the milk. Or another is that she's in a little colony and all of these mamas are breeding at the same time and they share their litters very happily. And so it may be that one of these mothers is infected and is infecting kittens that belong to another cat.
Hey, Julie, we have a poll that we were supposed to do earlier. Would you like me to do that real quick?
Please do, and butt in whenever I skip past those, because I don't have them on my list.
Not a problem. I missed it myself. So it's actually, we have two quick polls for folks that we would like to know here. So if you work with the shelter, rescue, or vet clinic, does your organization test for feline leukemia and FIV? All cats for feline leukemia and FIV, all adoptable cats for feline leukemia and FIV, all cats for feline leukemia only, all adoptable cats for feline leukemia only, and then other, describe in the chat, when I say in the chat, I mean the questions box. Sorry for the confusion, folks. So we have all cats for feline leukemia and FIV, 45%, 28% all adoptable cats for feline leukemia and FIV, 3% all cats FeLuke only, 5% for all adoptable cats for feline only. And then I'm going to go in this questions and see only if symptomatic, only if requested. We don't test TNR cats, that's right. Kittens for feline leukemia only, adults for feline leukemia and FIV. We test 1 per litter or mom if we have her. All right, and I'm going to do another quick poll. Do you test cats that are going to be TNR'd? Yes, no, or depends, and put the depends in the questions box.
Interesting.
It looks like symptomatic here.
Can you tell me the first number again?
17% is, do you test cats that are being TNR'd? 17% do testing.
Okay.
52% say no, and then 31% say it depends.
Yeah.
Showing most of them are saying it depends on, it's symptomatic, if there's something going on. Usually it says we test because we think they're going to go back to the same place. Sometimes they're going to a barn, therefore we feel like we need to trap them. Super symptomatic become on request. I think it's that adoptability issue. Test if friendly and adoptable. Anyway, so those are the opinions on there.
So I think those are very common reasons why you might test. I think the folks that are currently testing all of their cats kind of routinely, this is an opportunity to give some thought to whether that the effort that you're putting into those is the right way to spend your money. You know, we never have enough money to do everything we want, and if we want to help the most cats possible, it really is our obligation to choose wisely. And when we started our TNR program, we definitely had we tested everybody. We tested thousands of cats, and we spent a lot of money doing it, and we identified very few positive cats. So most of our money was spent on negative cats. And then it was our policy to euthanize cats in the clinic under anesthesia when they were there. And it caused a lot of grief for us in the middle of a very busy clinic and really disrupted our volunteers. And it just seemed inconsistent with our life-saving goals. So we decided, we actually visited the San Diego Feral Cat Coalition and looked at their clinics and saw that they didn't test. And that was a life-changing moment for us to go to San Diego and see how another program worked. And we came back and advocated with our board to stop testing, and we lost a board member over it. Like, it was not an easy decision, but it is one of the few decisions I've made that I've never regretted in any way. Like, it was positive 100%, and it allowed us to scale up our program for all of our volunteers to be happier. And we know that because we scaled up the program, we were reducing FeLV and FIV more effectively than we were as a smaller program. And so I'm just very, very confident that this is the right thing to do. And you can certainly use materials from this presentation. You will get a copy of all of these slides and some handouts to go to your vet or your board to encourage them to maybe remove, some of the testing that you're doing that isn't indicated on an individual cat basis based on their condition. All right, I'm gonna have to speed up because I've got a lot more to share with you today. So the quantitative tests that we've just been talking about, this is really what it looks like in a different form as far as interpretation. So let's start with the red, the progressive cats, because they're more straightforward. They are going to test antigen positive. So that SNAP test or the other point of care test will be positive, and they will have a high PCR copy level. So the lab is going to give you a result and they interpret it for you. And those are the cats that as a group have a reduced lifespan. So that doesn't mean everyone in that group will, but the average, like I'll show you, is much riskier. Now, that doesn't mean that we interpret that to be these should not be adopted. If you think about other populations that we adopt out, like we adopt out senior pets, right? You could say the same exact thing about a senior pet. It might not live very many years. It might have some ongoing health problems that you have to deal with. And it might need some expensive medication like arthritis medication to stay comfortable, but it still deserves to be in a loving home and to have a home that's appropriate for a senior pet. So we should be talking the same way about our cats with FeLV. Now, if you get up to the regressive cats, these are the ones that are head scratchers a lot of times. And if you test these cats over time, you can get different results at different times. So they generally will have that positive SNAP test, but they can have a negative PCR test, or they may actually have a negative SNAP test and a low level of virus on their PCR test. So this is where you start to get those discordant tests where the point of care test is different than the PCR test. And that's what regressive cats can do. And the reason is they have a low amount of virus. And some of them are so low, they're just sitting on that edge of detectability. And some days their virus count circulating is below the level of detectability, and on other days it rises up a little bit. But either way, we think this is a group of cats that has a very good chance of having a normal lifespan. They won't all. Some cats, they lose control of the virus and it comes back and they kind of progress into more of a progressive stage, and they have earlier mortality and start shedding again. But this is really interesting to us. And so this is kind of the take-home snapshot if you want to put an image in your brain. These are we started with 130 cats and had quite a few that made it to this phase. We are now at the 4-year time point of following these cats, and it is our goal to follow them for the rest of their lives. It'll be the only lifetime study of cats with FeLV. The problem with a lot of the research that we rely on is for long-term studies, they're almost all laboratory cats that were experimentally infected with laboratory strains and live together in that sort of unusual, unnatural environment. And so we learn a lot from those cats, but we are hesitant to extrapolate it too much to pet cats because pet cats have a lot more influences on their life than laboratory cats do. And then studies of natural infection are usually just at a point in time, not sequential over life. So this is the first study to do this, and we're very grateful. The study was funded by Maddie's fund. A lot of testing was contributed by IDEXX and some other laboratories. The cats were all managed by our good friends at Austin Pets Alive. They have a large FeLV adoption program, and all the analysis was performed at the University of Florida. So a big multi-institutional effort. So the way you read these survival curves, on the left is the percent survival. So it starts out at 100. So it's actually the percent alive. So it starts out at 100. And then on the x-axis, we have the follow-up time in years, and we're up to 4 years. And what we see is a group of cats that were negative and had the low amount of FeLV. They are doing really well. The vast majority of them are still alive at 4 years. But the cats in the high group, which was most of the cats, was 3/4 of the cats, they just had a steady decline in survival, pretty straight line. And about, we get to the halfway point, what would be 0.5, that's about 1.5 years after their first positive test in the shelter. Now, that doesn't mean cats only live 1.5 years. We have no idea how old they were when they came in, or how long they had been infected before that. But starting with the time point of a cat coming into a shelter, about half of them made it to 1.5 years. And then, but if we look at, now we're into this group of survivors, over 20% of the cats are we're not losing them anymore, and they're staying alive. So this seems to be that group of hardy, progressively infected cats that it doesn't have a physical effect on the cats. So now I made the slide more complicated, and I always hold this one back to the end of this part of the talk because I could just see your mind freezing up when you look at it. And this, again, you will have this presentation that you can download, so you can study this and clip it out and kind of have it handy for when you're interpreting tests. It really is, for the most part, just a different view of what I showed before. You can do level 1 diagnostics. That would be that UF plan A, one and done, in just that left half of the screen, and just stop there. For most cats, that's good enough for diagnosis. But if you want the prognostic part that gives you a clue about long-term outcome, then you can add that PCR. And with the FeLV part, you get the quantitative, and if they're positive, then it breaks into that high level and low level. So I would say when people talk to me about their testing confusion, one of the common things is a litter that has some positive cats and some others, and they want to know, are all the kittens infected? Because they don't really want to hang on to these kittens for months and months for it to sort out, right? They want to move them on and get new kittens into their program. And so PCR test on the kittens might be a way to speed up that time frame. Also, if there's tests that you're just really confused about, like why is this indoor cat suddenly FeLV positive? Do I trust the result? Well, come and do a PCR test, and that will help. Or there's cats that you expect to be positive that are not. like a litter mate or maybe a cat that came from a really high risk hoarding situation, a PCR test might be additional information there. All right, now, because I'm coming from the university, we have a test for you all. So the way this is going to work is I have a series of cats. These are just shelter cats, real world situations that our shelter staff and volunteers have to encounter, and many of you may have encountered cats like this. And so you are going to be the doctor here. So what we have, we're starting here with Sierra's, is a kitten that came in. She's 2 months old. She came into the shelter. They did the snap test on whole blood, and they got a negative result. So this is common, right? This is probably the most common experience that you would have when you're intaking kittens. So Stacy's going to put a poll up now, and you're going to make your choice. What are you advising the owner or the volunteer if you are the vet and you get this result? Is the cat uninfected, regressively infected, progressively infected, or you want to routinely recommend additional testing?
All right.
And I wonder, I can't see the poll, but I wonder, Stacy, are you getting a brisk response, or are people holding back because they're scared, even though it's anonymous?
It's well, I'm at 63% voted right now. So when
Okay.
I usually close things down when we hit about 80, but I think that there was probably the first 50%, everybody kind of raged forward, but now we definitely have a slowdown. So now, now we just turned 70. Now I think we got the thinking going on here.
Okay, I like shamed people into voting. Yeah, I see this with my veterinary students too. And it's, life and death, right? Or at least big pathway decisions for these cats. It's not an inconsequential thing, even though we do it so routinely. And as you might expect, I'm going to start with an easy case, and it's going to get harder.
So what we have here is 79% say uninfected, 3% say regressively infected, and then 18% said recommend additional testing.
All right, those are good. So, and they could all be right. So the best answer to this would be we would call her uninfected. Like, we have no evidence that this healthy cat that came in has been exposed to FeLV. She's got a snap test that's negative. Now, she could be regressively infected. And if she came from a mixed litter or something, or a high risk situation, I might kind of hold out and want to do additional testing. But for me, if running a big busy shelter or a rescue group, I would say one and done. I'm going to call her uninfected. And I think in our paperwork, our medical records that go home with the owner, we can explain the uncertainty, and that if they want to have the cat retested at their vet, that's just fine. And then there was recommended additional testing. There are some groups that just routinely do additional testing. Like, I know Monica will probably talk about their program to spin down blood. Well, if it's positive, they'll spin it down and look at serum. And I'm not aware of groups that just routinely would do two-layer testing for every single cat, even if they're low risk. So this is what we got for her. This shows you what our study was like. For 6 months, we tested with a panel of tests. And so what we saw, what the tests that we used were the SNAP test on whole blood, plasma, and serum. So 3 different kinds of sample. We did the PET check, which is the laboratory test that they would do at IDEXX if you sent it away. It's a plate test on plasma and serum. We did a PCR test, and we did an IFA test. So basically, like every test you can run, we did on these cats every month for 6 months. And so she was negative on everything. So we would call her uninfected. And in fact, she stayed that way the whole time through this whole study. So this is like your classic cat. Your first test, screening test, was accurate. So let's move on to Basil. Basil is a 2-year-old female spayed cat at the time that she came into the shelter. She's got a tipped ear, so somebody thought she was a TNR cat at some point, and she went through a TNR program. So she had a snap test on whole blood, and it was positive. So now we have the same test. You can put the poll up, Stacy. Is she uninfected, regressively infected, progressively infected, or you recommend additional testing? People are thinking, Em, you should be thoughtful about these things. But it's also anonymous.
Just give it a couple more seconds.
Test, so there's not really any risk here of going for it.
All right, I'm gonna close the poll and share the results. So 0% say uninfected, 11% say regressively infected, 9% say progressively infected, 81% recommend additional testing.
Ah, very interesting. Thank you. It sounds like a lot of folks have been sort of listening, or they've previously been noodling over these topics. And so I assume that the reason for additional testing would be to clarify the status of this cat as to high or low, so that there could be some prognostic information. And that's what I would do, because I'm super curious about these cats. As far as using my organization's budget, though, I might pause and say, do I really need to know that information? Because what you're going to see is my recommendation is these positive cats, regardless of their high or low status, get adopted into a home. And knowing the level may be more information than we really need to know for that path. And it's not inexpensive. So that, at least to rescue groups and shelters, the cost of this test is around $50 or $60, I think. And then if you're going to private vet, they're going to have to probably double that before they give it to you. And so it's not inconsequential. You can imagine how expensive that can become quickly if you're doing hundreds or thousands of cats a year. So I think everybody really understands the pros and cons of this, and they're using that information to make decisions for the cat. But I think on a mass basis, for high volume cat management, I would probably just stop here and call her infected. So this is what her results were on the whole panel. She was positive on everything and had a high positivity on the quantitative PCR. So we could put her in the progressive group, but she should still get adopted, and she did. And she stayed month after month. We even did some extra testing a year and two later, and she stayed positive. All right, this Crayola is our last case. This is a 3-month-old male neutered kitten. He came in with a snap whole blood test that was negative. So same thing, Stacy, a poll.
Yep, let me get this one out. Here we go. What is the cat's feline leukemia status? And as we say, uninfected, regressively infected, progressively infected, and recommend additional testing. Yep, 50%. Fast, fast, fast. We're at 60%. I'll just give it a couple because I know we've got a lot of information. So I'm going to close this poll because it looks like everybody's pretty one-sided on this one. Share the results. So we have 89% say uninfected, 3% say regressively infected, 1% say progressively infected, 7% recommend additional testing.
All right, and you can imagine this is a trick question because I already asked you about a cat like this, and y'all, I taught you to accept this result. So here's what we got. And we only got it because Crayola was in our study and we were doing a lot of testing that you would not do normally. So she was negative on all her point of care tests and on the laboratory test for antigen. There was no viral protein floating around in her blood. However, on the PCR test, we got a low positive. And so now we have a discordant test. We could interpret this as regressive. This is very consistent with regressive infection, where her virus is so low that it's just right on the edge of detectability. And this time, her DNA test was positive and her protein test was negative, and her IFA was negative. The IFA we don't really recommend anymore. It's just not very sensitive. Now that we have PCR that's been validated, it is really replaced IFA. But it's more complicated than that. Look at this kitty. The next month, she was positive across the board in such a high level that we would call her progressive. So if we randomly had, intaked her a month later, we would have had a completely different assessment on that point of care test and put her in a different path. And then if you look like over time, that point of care test changes. So this is where I want to introduce that sort of level of uncertainty that no matter how much we test cats, for some of them, we can't know for sure. And we can't sit there and test cats every month with a panel of tests. It's not going to make any difference. And to my mind, as soon as we get a hint that a cat may have FeLV, I just track them towards an FeLV placement. And I've given up on the idea that I need to keep testing until I convince myself I know what the case is, because this is probably, thousands of dollars worth of testing in this panel. And you could see she goes from progressive to regressive. She's got 1 month 5 where all of her tests are negative, and we would have called that abortive if she ever had a positive test in her past where she completely cleared it, but then we would have been wrong because she comes back again. So this is not, I'm sure this is giving everybody knots in their stomach, but really what it does, once you accept that this happens in some small proportion of cats, it is unusual, that we really need to manage our programs to the majority and not freak out about this little population of cats that are going to defy everything we do. And then I'll tell my one story. I've been telling it for years, but it really was groundbreaking for me many, many years ago. That helped me give up on the idea of testing until we know. So we took in a mother cat and her 4 kittens that were 8 weeks old, so 2 months old. We tested all of them. The kittens were all negative. We tested them with a snap test. Kittens were all negative, and the mother had a weak positive, but there was a weird thing going on with the control dot, and so we couldn't get a valid test. But we were cautious, so we separated the kittens from the mom, and we retested them with another brand of tests every month for 4 months. And we even did a PCR in there once. And this was back in the 90s, so quite a long time ago, different tests, PCRs than we have now. And we did IFAs too. So IFAs were always negative. When we did a symbiotics point of care test, it was always negative. The kittens were always negative on the snap test, and the mom would intermittently have this weird positive on the snap test. So the kittens, after rigorous 4 months of testing, always were negative. So we adopted them all out. We thought they're not infected. Adopted them all out to separate homes at the age of 6 months. And we adopted the mother to a home that had no other cats, and we said we just don't know what her status is, but we were safe. So fast forward 6 more months, kittens are now a year old, and I get a call that one of the kittens is FeLV positive and it's dying of anemia. And so I called the other 3 homes that adopted the kittens, and we brought them all back in, and they all tested positive. And they wouldn't bring the mother back in. So my conclusion for all of this is those kittens were regressively infected back when they came to us at 8 weeks of age. And despite rigorous testing, we were wrong. We missed it. And it all turned progressive later in those kittens. So knowing that and working with these 130 cats at Austin Pets Alive, I decided that rather than making my algorithms more and more complicated, I should just simplify them and know that there's a degree of uncertainty and be transparent about that degree of uncertainty when we adopt cats out. So I hope that's helpful and not just causing a freak out. All right, on to something much easier. Just a reminder that FIV positive cats can mingle. This is a group housing unit. A lot of shelters are going to these, and some will have a room for the FeLVs, a room for the FIV cats, and a room for the negative cats. Some shelters will allow their FIV cats to mingle with the negative cats, or they may have stopped testing for FIV altogether. All of that is fine. There really is a lot of research now and a lot of anecdotal personal experience that having an FIV cat in a group of cats that are not stressed and that don't fight is very, very safe. The most safe is to totally separate the cats, but it is just only slightly risky to move them together. And we don't really make a big deal of when we're adopting these FIV cats out. We are transparent, we disclose it, but we don't like hold them back from being adopted into homes with other cats. So this is the paper that Annette Litzter did back in 2014 that really changed everything for FIV. She followed cats in a pretty crowded cat sanctuary that mixed the cats, and there was no transmission over 5 years. There's some more papers that touch on FeLV a little bit, and FeLV definitely spreads within households, and it spreads even more within crowded shelter conditions. So we definitely want to house FeLV cats together in a group or in individual housing, but not mix FeLV positive cats in with negative cats. So if you're not testing, just keep the cats in separate cages and get them into homes as quickly as possible, and then those homes can test. Also, we know these are immune suppressive viruses. So stress is very bad and allows these viruses to replicate more and for cats to get disease. So Dr. Litzter in another paper showed that cats that went to a sanctuary didn't live as long if they were FIV infected than if they went to a home with 0 or 1 other cat, which when you think about it, this is pretty logical. Like home life is less stressful than being in a big institutional setting. So as much as possible, we should get cats out of shelters and sanctuaries and into homes. Survival of cats with FeLV also has been shown to be longer if they're living in homes with few other cats than in big group situations. And cats, they seek small groups and not to be confined with large groups of cats. It doesn't mean that that all cats fit this mold, but statistically, they're likely to do better in a home. All right, another new thing that we're all dealing with is a paradigm shift for mass screening, and everybody's still getting used to this idea. In the past, it was sort of, just assumed that shelters should test all cats, that it was their responsibility to do this screening and then deal with the results. And for individually housed cats, that's not actually necessary. They are not going to spread these viruses in the shelter. The reason we test in the shelter is to make sure that we're not spreading disease, but it is optional for shelters. It is certainly appropriate to tell people these cats aren't tested yet. You adopt them, don't let them contact your other cats until you go to your vet and get a test. Now, I will also acknowledge there's some problems with that. One is I've never had an adopter follow my instructions. Like, you can sit there and tell them all the good things they should do with their new cat, how to introduce it, how to keep it separate until it's tested, and what are they going to do? They're going to walk in, open the cage, and let them all mingle. So we just have to acknowledge that that happens a lot. Also, right now, it can be almost impossible to get an appointment at a veterinarian. Veterinarians are so overloaded due to COVID, and we've got workforce shortages that it can take months to get in for a non-urgent appointment. And some clinics are not accepting new patients at all. So I also acknowledge that my advice comes with some hurdles, but wanted you to know about what we're recommending anyway. So the new guidelines, which we have a copy for you in the downloads, state that screening for the viruses increasingly is shifting from animal shelters, where cats are adopted, to veterinary practices, where cats receive their comprehensive care. And if you just think about it, like, we don't do top to bottom examinations of animals in shelters. Like, we don't do hip x-rays on dogs and echocardiograms on everybody to make sure, and blood work, CBC and chemistry on everybody, screening for everything that might be wrong with that pet. What we need to do are the essentials that don't get in the way of us helping the most animals possible, and then being really clear with adopters about what has been done, what hasn't been done, and what they still need to do. And also to transmit very good records about that, so that the new vet knows what to do, because we don't want the vets to be blindsided by cats not being tested, or by cats that are positive and are adopted in a adoption program specifically for them. One of the most tragic things we hear about sometimes is somebody adopts an FeLV cat intentionally, and they go see their vet, and their vet convinces them to euthanize it without even talking to us. Like, we want everybody to be on the same page. And right now is a transition period where we're still training. There really is no urgency to test cats that are housed singly. They cannot spread the virus based on, handling one cat and then going and handling another. It's not like panleukopenia or respiratory infection. And then as we talked about, TNR resources are really better invested in spay-neuter rather than testing. That if we can increase the number of cats we're neutering in the TNR programs, we will reduce both kitten births and viral transmission faster. So it's a better plan to just really focus on increasing numbers in TNR. So what we still need to do in shelters and in rescue groups is test those high-risk cats. So testing is part of the workup of a sick cat or a cat that has had a history of exposure. We probably are, it's helpful to know that while the cats are still in our care so we can put them on the best path to the best outcome for that cat. We can test to avoid in-risk. So if we have mostly group housing, those cats should at least be tested for FeLV before cats are put into group housing. It is really risky because cats can spread FeLV if they're face-to-face. Sometimes shelters will test just before they do something really major, like a major surgery on a trauma case or something. Doesn't necessarily mean that the positive cats did not get that major procedure, but there might be a different way that they approach it. And sometimes if we have legal cases like hoarding cases or cruelty cases, we might test just as part of the evidence about how those animals have been cared for in the past. And then all of this, as I mentioned, requires a lot of outstanding communication. The adopters really need to understand what's been done and what hasn't, and they need to commit to keeping their cat separate until that cat is tested. And if you sit in the adopter seat and kind of imagine they're super excited, they just pick their cat, they're waiting for it. Whatever you do when you're talking to these people, don't have the cat in the room when you're talking to them because they won't hear a word that you're saying. But even then, we're bombarding them probably with hundreds of bits of information, and people have the ability to remember about 3 things. Like scientifically, that's what you can walk out of a conversation with are 3 highlights. And so this needs to be one of those 3 highlights. And a lot of other stuff can be in a conversation and written in notes about instructions for going home, but my experience is that they usually don't read those. And then we need to assure that there's a smooth handoff of care from the shelter to the veterinarian. So good records, a note, a cover sheet that says, hey, they've just adopted a cat from us. Here's the scoop. Here's what's needed next. Here's what the advice that we gave. That's really, really handy. And an opportunity also to get in front of the veterinarians as a group, like maybe go to their local VMA meeting or go visit all of the practices to identify the ones that are going to be really shelter friendly and the ones that like taking care of FeLV positive cats so that you can advise your adopters appropriately. So here's an example of a letter that was sent out by the Edmonton Humane Society quite a few years now. And they very clearly just explained what they changed and why they did it. And they found that there was really little pushback from the local veterinarians when they did this. It made sense, it was logical, they all bought in. So that, don't surprise your vets with the new protocol. Get them in, and they don't all have to agree with it, but they should at least be informed. Here's a summary table. You'll have this, it's in the guidelines, and you'll have a copy of these slides, so you don't need to kind of study it right now. But it is a summary of recommendations for testing and vaccination in animal shelters, and for different kinds, like individually housed cats, cats that are short-term group housed, like in a shelter where they're being adopted, foster cats, cats in long-term group housing and sanctuaries. That's a little bit of a higher risk situation. We've seen in sanctuaries a little more virus spreading, and I think maybe it's because they came in and they were regressive. They were missed on the intake screening, and then it came out and spread a little bit around, and then trap-neuter-return cats. So you'll see, depending on the nuance of who you're testing, we actually have quite different recommendations as far as who you test and who you vaccinate. FIV vaccination is not available in North America anymore. That vaccine was taken off the market in 2015. But for our international attendees. It is available in some places like Australia and Japan and some other countries, and so that's why we included it in this guideline. All right, I'm going to finish with adoption. This is where there's a real push. We're going to hear about some exciting adoption programs later in the day. And I would say this is where the real transformation is happening in cat welfare right now, that it is almost a snowball effect of shelters and rescue groups wanting to adopt these cats out. They reach out all the time for advice. A lot of times it's a volunteer that's more progressive, and they come to a meeting like this and they want to know how can they go back to their organization and get it to change. They would like examples of handouts and signage and procedures to make this work. And so that's really exciting. And we'll give you we're going to arm you with that kind of content today so you can do that. So for the Austin Pets Alive program that Monica's going to talk about more, this program's been going on for many, many years. Austin Pets Alive is a no-kill shelter, but it's a big one. They take in thousands and thousands of cats and dogs each year. They're in Austin, Texas, of course. And for FeLV, they started an adoption program for FeLV. It was very exciting and successful. And so they then started accepting cats from around the country into their FeLV adoption program. So all of those little cat faces that you see on this map is where cats came from originally that were in the 130 that were in our study. Now, there is a limit to how many they can take. They do take in hundreds, like sometimes 800 a year, or no, 400 a year, cats that are FeLV positive, and they get them adopted. So they are big scale, but there's a lot more cats out there. And so rather than be thinking, how can I get Monica's number to get these cats into Austin, you should be thinking about, how can I pick Monica's brain so I can start a program like that here in my town. That's what we're pushing now. And it really is catching on like wildfire. Super exciting. So one of my veterinary students did a study on the outcome of cats that were referred to the Austin Pets Alive adoption program. She looked at the most recent 2 years of data. That was 800 cats. And of the cats that were referred, they could only confirm infection in 81%. So about 20% of cats they could not confirm infection in, and they adopted them out as negative cats. And that just kind of emphasizes the dilemmas with testing. And also we saw some pretty shoddy testing processes in the referred cats. A lot of times there wasn't even a record of what kind of test it was, where it was done. That's all very important to record. And so then if we look at the 81% that entered the FeLV program, 80% of those were adopted. So 8 out of 10 were very, very successful. That is a good success rate for shelter cats. Almost 2 out of 10 either died or were euthanized, and a few were still in the shelter. So you can achieve results like this, and it doesn't have to be hard. A great additional thing that came out of the Austin Pets Alive program is they surveyed adopters to find out after the fact how satisfied they were. Like, did they regret doing this? Was it awful? Did their cat die right away or whatever? And what you see is the vast majority of people were very positive, and only 5% had a negative experience living with their infected cat. And then again, a great follow-up question was, would you do it again now that you've been through it? And 73% said very likely. Another 11% said somewhat likely. So really, like 9 out of 10 of your adopters who do this once will come back and do it again. And there's a few reasons for that. One is this is a concierge service. Like, if you come and you indicate a willingness to adopt an FeLV positive from Austin Pets Alive, you are going to get a personal assistant to help you do that. You're going to get red carpet treatment and one-on-one support, and they offer post-adoption veterinary care for problems that are related to the FeLV problem. So not all care forever in the future, but if it's related to FeLV, they will provide free veterinary care. And just that safety net, knowing that the shelter has your back with these cats, is another thing that gives people confidence to do this. They also looked at how many people took them up on it, because I'm sure some of you are going, that sounds great, but we can't afford that. Is very few adopters actually used that option because often they didn't ever need it, or they just preferred to use their own veterinarian anyway. So yay for this. A really positive attitude and good customer service is really all you need for a successful FeLV adoption program. So this is the website on Awesome Pets Alive. I highly encourage you to go to their website, just like if you were looking for a cat, and poke around and see how they market their cats, but you'll notice it's all positive. There isn't anything about like danger, and segregation. They don't like plaster FeLV all over the cage. They lead with the personality of the cat, which is what all of our adoption marketing should be. What kind of cat is this, and what kind of home would he be in? So if you click on the kind of cat that you want, well, they have a whole website on special needs animals, and you can filter. You can see on this one, I filtered at the top on FeLV positive, and it's got all these profiles of all these cats. And what you can see is they look great, right? They've got cute names, they've got cute pictures, and if you click on them, you learn more. So, and if you look at this page, there's lots of cards. They have quite a few cats that are waiting for adoption. They move them through pretty fast. You can see these cats happen to be in foster care, so they foster out their FeLVs as well. But also transparency. You can see there's a paragraph there that's educational, that is very clear about they might have a shorter lifespan, but they can have the same quality of life. This is another shelter that started an FeLV program. And I can say from all the calls I get, I think the thing that makes shelters start programs, the pivotal point for most of them, is they end up with a cat they really like that's positive. And that's exactly what happened at Treehouse Humane Society in Chicago. Is some foster parent volunteer raised a litter of kittens. They came in at 8 weeks and then tested positive. And in their policy previously had been to euthanize positives. Well, we're all eventually, if we do this enough time, going to be staring over the table at a volunteer who has just raised kittens for you. And do you tell them you're going to kill their kittens now, or do you say, let's try something new? And so that's what the veterinary did in this case. She said, let's see if we can adopt him out. That would be great. And luckily they have this great PR department who made this beautiful sign that just the vibe is so uplifting and hopeful and makes you love the kittens. The little butterfly is saying FeLV positive cats deserve loving homes too. And I like how they use the FeLV positive, almost like they're saying a positive message along with the test result. So they went all out. They used this as a media event. They put the kittens in their own room, and they're certainly adorable. And they wrote a press release that, and there were blogs about it, that the shelter launches adoption programs for FeLV positive cats, and they all go home. And this is like, if you can get over the fear of starting something like this, I guarantee you'll have the same experience, and you get a lot of good PR, good image for your shelter. They came with a nice fact sheet. So again, education and transparency is very important. So this is both for the adopter and for the new vet that they go to. And once again, you know, blogging, webbing, and what they did in this case, they had a new shelter and they had built a cat cafe. And it's really the nicest real estate in the whole shelter. And their FeLV adoption program was going so strong that they decided that the cat cafe would be an FeLV positive cat cafe. So this is a real twist and a flip. Instead of hiding FeLV positive cats in the back with a bunch of scary signs, they are up front in the best real estate in the whole shelter. So all of the cats in that room are FeLV positive, and it's a place that's really fun to come and hang out and linger comfortably for adopters. So they have a really good track record of moving the positive cats through efficiently. And I've never been to the Nico Cat Cafe. It's another one. It's in Seattle. If anybody on the call has been there, I would love to hear them describe it. Next time I go to Seattle, for sure, I'm going to track them down. But they are one of the first, or maybe the first, to have an FeLV positive cat cafe. They take from the local shelters and sometimes from distance shelters as well. But what I'd say is, what they've done is really upscale this. Like, this looks like a nice hangout. It's a bar. They've got yuppie snacks, beer and wine. Like, this this is far more than a cafe. And this is the place where you hang out with the cats. So comfortable. And I have to go and find out where to get those little side tables in the shape of a cat, because I really want one. If anybody knows, please let me know. So I love this quote from Dr. Sheila Segerson from Maddie's Fund. These are pictures of someone with the cat that they adopted. She said that people are adopting these cats, loving them, and not regretting it. And Maddie's Fund has been so pivotal in helping us spread the word. They funded this multi-year study that we're still doing on testing and outcomes and sharing the results why. We're really grateful that they've been so far-sighted to identify the needs, to understand how we help these cats, and then to throw the resources behind it so we could. So I just gave you a lot of information, and I'm sure that you are like, I want more, or I want examples of the documents and things. And there's a couple sources I wanted to make sure that you were aware of. One is American Pets Alive. Their website has all of these documents and examples for the Awesome Pets Alive feline adoption program. So you do not have to start from scratch. Someone else has already written up the greatest FAQs ever and good signage and good blogs. Like, just copy each other. That's why it's out there. And Monica's on later today. I'm sure she's going to encourage you also to pick her brain and copy what they do. Also, just this week, a brand new shelter medicine textbook has been published. This is the second edition of the Infectious Disease Management in Animal Shelters book. This is by experts in shelter medicine, and it's got, you know, everything that's common and some things that are not so common on the infectious disease world that rescues and shelters need to know about, and everything from preventive care like vaccines and testing to how you deal with disease outbreaks in cats and dogs and exotic species. So with that, I'd like to thank Maddie's Fund for making our programs possible. They fund our program at the University of Florida Shelter Medicine Program. They fund our Million Cat Challenge program, which as of today has saved through over 1,000 shelters, over 3.3 million cats since 2014. You can still join the Million Cat Challenge. If you go to the website, you can sign up your rescue group or your shelter and be part of this life-saving. And they funded our study. So we have a lot of gratitude for that. And did we have any other polls? We do, I think.
Yes, one more poll, so I will put that up. How comfortable are you now in adopting out cats with feline leukemia and FIV? I want to adopt out #all the cats. I'm more comfortable adopting out FIV positive cats and feline leukemia positive cats. I am all in, but I need help getting my organization on board. So 74%, they are all in. Everybody's in, 74%, that's awesome.
Yep.
Because no one wants to transport a feline leukemia positive cat from, you know, Wisconsin to Connecticut. So the less we have to do on transport, the better off we are, for sure.
For sure.
I am more comfortable adopting out FIV cats than feline leukemia positive cats is 15%. And then we have 11%, I'm all in, but I need help getting my organization on board.
That's really heartfelt. And maybe this is an audience that's already pre-selected for loving these cats, I suspect. So, but I think the folks that are looking for help getting started, you're going to get that in the rest of the day. And I'm really very, very grateful for everyone coming to this. I think we have a couple minutes for questions, maybe too.
We do. Yeah, Julie, if you want to throw on your camera for a couple minutes, that'd be great. We have about 4 minutes for questions. So there were a lot of questions that flew across the wires, thus the ponytail, the Stacy's questions ponytail. Things get serious now with regards to the conference and the learning and people's minds exploding with all that incredible information. So I have themed the questions. So folks, just if you're not having your specific question answered, please do not worry. Do not worry about it. We will do our best. Later, I will sort through all the questions individually. But okay, so lots of questions about PCR tests you know, how can you access them, and are there any ways to control pricing? A lot of comments about PCR tests are really expensive.
They are, and that's just the way they're going to be. So how can you access them? For the IDEX test, which is the one we have been working with and we understand the most about, you just get a blood sample and send it to IDEX on your account. It's a whole blood sample. Now, one of the sponsors of today's conference is CatDX, and they are offering a new PCR test that is about half the price, and it's based on swabs of saliva. And I'm really excited about that because that can make testing obviously more accessible, both in that you don't have to collect a blood test and you mail it in a shipper that they provide, and it's cheaper. So what I don't know is, this is a surprise to me. I just learned about this option as a result of this conference. And I've already reached out to the scientists there because I'm interested in working with them to learn more about what the place is. We do know that saliva may be a little less sensitive than blood, and that could be good or bad. If you only want to identify the shedding cats and the progressively infected cats, it may work that way. I just think we need to, I need to get my head with them and look at the raw data and understand more what their process is. I actually also reached out. We're dealing with a lot of canine distemper in Texas, and doing the PCR testing on the mass scale through the lab that we normally use. It's really expensive and slow. We're overwhelming them with the volume we need to test. And so I'm curious, they don't have a distemper test now, but I'm like, what do you think about doing that? That's a dog one. So the pricing, I don't think you're going to get them to budge. They already have discounted it from their normal PCR price range to help shelters as much as possible, but it's just an expensive test to perform.
And is there any way to access any of this testing without having a veterinarian sign on
Absolutely.
to it?
Yeah, anybody can open a IDEX account and send in samples. You don't have to have a veterinarian that is overseeing it or receiving the results.
Okay. Lots of questions around when to test with regards to the age of kittens, as well as when to test upon intake. So, you know, you've got the kitten issue there, and then also, like, say you take kitten or cat in, and we test immediately, or do we hold for a while? So sort of that timeline.
Yeah. The second one's easier to answer, that is taking kittens out of the equation. It's just test on intake. The day they come in or whenever they're getting their veterinary exam, test them and get them on that path. You know, all of our shelters across the country are packed. What we need to do is move animals through our system as quickly as possible so they don't crowd, they don't get backed up, and they don't get sick. So there is no benefit to waiting, unproductive waiting. We really need to look at length of stay in every kind of organization. Say, why are you still here today? And it's like, well, I'm waiting for something. Let's eliminate all the waiting. So test at the beginning, and then you can parse them into the paths and the marketing you need to do. Now, kittens. There's a whole pile of questions that involve kittens. So one is underage kittens, which are really common this time of year. When should you test them? And then there's the sort of normal kittens at 8 weeks. Is the test that you do pre-adoption going to be valid? And so let's take the easier one, which is the 8-week-old kitten. Most of the time, if you test that 8-week-old kitten with a combo test, you'll get the result that is accurate. Now, if they test FeIV positive, we all know that those may be antibodies from their infected mother, and those will eventually go away. Kittens are rarely infected with FIV. They are sometimes, though, so you have to separate them and test them later. FeLV, that eight-week test is going to be accurate, probably as often as it's accurate with adult cats, very most of the time. Now, orphans. So if they were born to an infected mother and then they were orphans, so they had a very recent exposure, they could be infected but not positive yet, because it can take, you know, up to 30 days to show positivity. And that's a bit of a dilemma. And I ran into it in our rescue group when we took kittens in, gave them to a volunteer, they raised them up, became very attached, and then at 8 weeks, they're positive. And we weren't really, back in that day, prepared to deal with the positives, so we were euthanizing some positives. And now you've got distraught volunteer or distraught veterinarian, like everybody's unhappy with that situation. So now in my program, we test the kittens even if they're a day old, and manage them according to that test, and then test them again at 8 weeks. We also got burned because we we tested as neonates and then didn't retest at 8 weeks, and we missed some and adopted them out. So now I do both. They may not be practical in large scale programs, or if you don't have a vet seeing the kittens and when they're a day old and they're a little bit harder to get a blood sample from.